Hello everyone, this is Mila. Today I'm reading Chapter 9, Oxidative Stress and Your Eyes. Nothing could slow Mavis down after long losing her husband many years ago. She had grown tough and independent. She loved to travel and venture out on her own without a trace of hesitation. Mavis knew that living was all about. No, nothing could slow Mavis' arrangement down, except the dark fear of approaching blindness. Back in 1983, Mavis, who loved to watch lights storm spike the night sky, who could distinguish subtle difference in the seamless, endless landscape of wide-open Paris, noticed she was having difficult time seeing it. When her sight didn't get any better, she decided it was time to make a trip downtown to visit the local eye doctor. He diagnosed her that day with macular degeneration, and everything seems to move in triple slow motion as she made her way back to her car. Though Mavis was not familiar with this particular problem, she knew she must use the eyesight she had left, and time was running short. She brought herself up to speed by reading everything she could about her disease. If there was a solution to be found, Mavis would find it. But what she read wasn't good. The book said doctor could do nothing for her but watch her vision deteriorate. And that's exactly what happened. Over the next 14 years, Mavis' eyesight continued to decline. At first, she had to give up night driving. Then she found that driving in the winter became impossible too because the gray sky would blend with the road. Winters last a long time in South Dakota. The old Chevy now remained parked in the driveway, by the same gritty determination that drove. Mavis through many a blizzard drive her to find solutions. On the April day in 1997, my phone rang and Mavis spoke up. She called the right place. After sharing with the South Dakota woman everything in this chapter on macular degeneration, I explained the recommendation dose of nutritional supplements. Mavis started taking a potent antioxidants and mineral tablets among the high dose of grapeseed extract. With a couple of months, Mavis' vision began to improve. Her eyesight became cleared, even her night vision getting better. We're thrilled that the next time she visited a local eye doctor because he confirmed the good news. In fact, her vision that day was the same level as it had back in 1991, 6 years prior. The old car didn't sit in the driveway anymore. Mavis had place to go, things to see. Winter and nighttime drive were still a concern, but the old gripping fear of losing her vision didn't slow Mavis down anymore. This hardly charged woman who now have to look again in Al's huge night sky, wide open Paris until the Lord took her home in the fall of 2001. The problem of eyes have. The roots of oxidative stress is the cause of degenerative change in the eyes, had generated a significant interest in use of antioxidant mineral, vitamins, and means of preventing even treatment of eye disease. No fewer than 6 large multicenter clinical trials are presently ongoing to study carefully the use of various nutritional supplements in the following disease. Cataracts. Cataract surgery is the most common surgical procedure for patients more than 60 years of age. Its economic impact in the U.S. healthcare system is tremendously. In the U.S., eye surgeons perform 1.3 million cataract surgeries each year at a combined cost of more than $3.5 billion. It has been estimated that 10 years delay in the development of cataracts in the U.S. population will eliminate the need of near half of these surgeries. The lens of the eye collects and focuses light on the retina. In order to perform its job properly, it must remain clear throughout lifetime. As we age, various components of the lens may be damaged and opticity may occur, leading to age-related cataracts. Medical researchers believe it is essential to determine if supply adequate level of antioxidant nutrients to the eye earlier in life will preserve lens function, protecting them from cataract's functional formulation. Basic research studies support the theory that free radicals are once again the culprits. They arise of the ultraviolet sunrise damage from the cataracts. The natural antioxidant the body makes, glutathione, peroxide cataracts, and superoxide demulcentase, form the eye's primary defense system. But researchers have realized that the natural antioxidant defense system is not adequate in fully protects the eyesight. In fact, several clinical trials have considered the possibility in increased dietary supplement antioxidant may be protected against oxidative stress to the lens. Antioxidants found in the fluids around the lens of eyes and in protecting the lens itself. This cataract development take place much faster rates of fluids around the lens contain low level of additional antioxidants. The most important antioxidant in this fluid is vitamin C. Vitamin C is water-soluble and found in high concentration around the lens. Other antioxidants found in fluids are vitamin E, alpha-lipic acid, and beta-carotene. Several epidemiology studies have demonstrated the association between the level of vitamin C, vitamin E, beta-carotene, and risk of developing cataracts. In Finland, a case control study shows individuals who had lower level of vitamin E and beta-carotene had a 4 to 5-fold increased risk of need cataract surgery. Another study shows that those individuals who consume supplements had at least 50% decrease of developing cataracts. Good medical evidence exists to show that the natural antioxidant protection of young lens decreases significantly with age. Several different clinical studies provide evidence that when people use various antioxidant supplements, this protects the eye aging. Researchers have found that higher of the level of vitamin C found in adequate fluids around the eye, the greater the protection against the cataract formation. Because of its synergy of effects, alpha-lipic acid have been showing it banishes the work of this antioxidant protects the lens of eyes. Recent clinical studies also reveal that both alpha-lipic acid and vitamin C have the ability to regenerate intracellular glutathione so that it may be used again and again. I only hope that over the next few years, all physicians will recommend antioxidants as a way to protect against cataracts. As the clinical trial begin to report their findings, we'll know more than specific antioxidant and supplement level of this antioxidant. And I believe sufficient evidence exists now to warrant encouraging patients to consume antioxidant supplements are a relatively inexpensive way to decrease this high incidence of cataracts formation. Macular degeneration. In US, age-related macular degeneration, ARMD, is the leading cause of blindness people more than 60 years old. For those who are not familiar with this disease, it's the decay of critical part of retina called the macula. This is where the greatest concentration of the photoreceptors locate and is the area responding for the central vision. When the area of the eye began to decline, was essentially losing central vision, our most important aspect of sight. If an individual with ARMD were to look right at you, he would not be able to see your face but could see things around you. In other words, peripheral vision remained intact. Macular degeneration presents itself in two different forms, wet and dry. 90% of cases involve the dry form, in which central vision gradually reduces, many progress of wet for about 10% of the time. No proven treatment for the dry form of macular degeneration currently exists. The wet form causes a more rapid reduction in central vision, the development of new vessel and possible vessel leakage. The wet form of macular degeneration potential treatable via laser photocollagenation. These treatments attempt to slow the new vessel production, which cause swollen, edema, or leakage or blending into the retina. And to stop the bleeding this leakage may cause. Blindness usually still follows rather quickly, however, prevents blindness. Americans estimate that 14 million Americans have evidence of ARMD. The Beaver Dam Eyesight report that 30% of people in the U.S. over the age of 75 have ARMD. 23% of the remainder will develop ARMD within 5 years. Mechanism of injury to the retina. In recent years, several researchers have made interesting proposals as to the actual cause of age-related macular degeneration (ARMD). The oriented suggests the light that enters the eye and is focused on the macula of the retina causes significant free radical production is the outer aspect of these photoreceptors. Again, if antioxidants are not available to readily neutralize this free radical, the free radical can cause damage to the photoreceptors. The form of oxidative stress has also been shown to create damage to the high concentration of polyunsaturated fat, PUFAS, in the outer retina and photoreceptors. Much like the oxidation damage to the LDL cholesterol, the oxidative and damaged PUFAS cause the formulation of lipofuscin, a group of lipid protein products that are collected within the retina, pigments, epithelium. Lipofuscin creates even more oxidative damage to the retina, and researchers believe it is actually the cause of damage to the destroyation of these sensitive photoreceptors. This toxic substance can accumulate in the pigment epithelium cells are very eventually excreted in the form of DOESN. DOESN formulation is the one of the first indication to ophthalmology that a patient is developed ARMD. As this DOESN accumulates between the pigment cells that their blood supply, they block the exchange of nutrients and photoreceptor cells can no longer function, causing an area of blindness. The generation of free radicals in the retina. As I stated, when the retina pigments and photoreceptor absorb light, the process of form of free radicals. High-energy ultraviolet and visible blue lights are especially capable of producing enemy free radical in the retina of eyes. As you may guess, patients exposed to these high-energy lights over an extended period of time have significant greater risk of developing ARMD. Studies suggest that as we get older, the antioxidant defense system that protects us against the free radical caused by high-energy light waves declines significantly. This obviously upsets the balance our body creates between antioxidant and free radical, lead to increased damage to the retina of eye. Several studies have shown that people with macular degeneration had lower level of zinc, selenium, vitamin C, carotenoid, vitamin E when compared to people who did not have macular degeneration. Clinical study examined the effort of supplementing individual nutrients to see if they could improve or slow the development of ARMD. Following is the condensed compilation of the result. Carotenoid. Now, Ray, eat your carrots. They are good for your eyes. I can still hear my mother arguing me to eat my creamy carrots before I could get down from the table to play. Do your parents ever tell you to eat carrot too? Doctors believe then that the beta-carotene found in carrots was necessary for good eyesight and night vision. This is true to a degree, but beta-carotene is only one of the dozen important carotenoids found in the body. It's actually more important to eat corn, leaf green vegetables, collard green, because they contain high level of carotenoid called lutein and zeaxanthin. Because lutein and zeaxanthin are yellow, they're efficiently absorbed with the blue light portion of vision light. Blue light is a major high-energy light that can damage the lens and the retina of eye. This with two nutrients present in the lens and macula. Our eye absorbs blue light, minimize oxidative stress. They essentially act like internal sunglasses. They screen out the harmful high-energy lights, decrease the number of free radicals that photoreceptor cells produce. These nutrients are also very potent antioxidants, such as able to help neutralize any free radical that occurred in this area of the eyes. Study shows lutein helps protect the eyes. Patients who took lutein and zeaxanthin in supplementation were not only able to raise their blood level of nutrients, but also significantly increase the level within the eyes. Macular pigment, which protects the retina from being damaged, increased 20 to 40% in this study, while the blue light transmute to macular photoreceptor and macular pigment decreased near 40%. The Journal of American Medical Association report in November 9, 1994, issued that patients who had the highest intake of two yellow nutrients, lutein and zeaxanthin, from their diets have 43% decreased risk of developing ARMD over had the lowest intake. Interestingly, these same benefits were not apparent with patients who had a high level of beta-carotene. Lutein and zeaxanthin are the only carotenoids that are specifically disposed within the macula of the eyes. Through beta-carotene found in creamy carrots is healthy for us to eat, it will not provide a decrease of ARMD. Perhaps what mom really meant was eat your carrots, as in carotenoids. Vitamin C. People with low level of vitamin C have an increased risk of developing ARMD. Vitamin C is highly concentrated in the fluids within the eyes, aqueous humor, and it's very important antioxidant for the retina. Studies indicate that supplementation with vitamin C can slow down the progression of ARMD. Vitamin C also has the ability to regenerate both vitamin E and the patent intercellular antioxidant glutathione. Vitamin E. Vitamin E are ARMD patients have lower level of vitamin E in the area of macula, where high energy lights produce excessively free radicals that damaged photoreceptor. Even though vitamin E is the most important antioxidant within the eyes, it is still a critical player. When a patient takes vitamin E in supplementation, he may provide protection against the development of ARMD. Coenzyme Q10. By now, you are familiar with the Q10 from the discussion on the cardiomyopathy in Chapter 7. Q10 is a patent antioxidant that is fat-soluble. Its nutrients has found to be great protector of the fat through the body. The retina of the eyes, which is made up in large part by fat. There is no exception. Patients with ARMD showing significant depleted amounts of Q10. Those patients with normal level of Q10 have greater capacity to resist oxidative stress that excessive free radical cause. Q10 is new in study of ARMD, and its effect appear promising. Glutathione. Glutathione is a very important patent antioxidant found within every cell in the body. It is especially critical within the lens of the eye as well as the pigments and the photoreceptor cell of the retina. Studies show that with age, the level of glutathione decline. The fact is imperative to consider in relation to the decrease of the eye with age. Several studies have looked at trying to increase the level of crucial antioxidant within the lens and retina of eye. Among research, it is well-known fact that our body absorbs oral glutathione poorly. Raising cell level of glutathione via method of next to the impossible. The best way to increase intercellular glutathione level is to provide nutrients that the body needs to manufacture the own glutathione. Remember, glutathione peroxide is one of the natural antioxidant defense systems that body creates. The nutrients needed for the body to make its own most effectively. Natural defense are selenium, vitamin B6, N, antioxidant L, quercetin, and niacin. As you learn more than cellular nutrition, you will begin to realize the importance of providing all these particular nutrients to the cell. In this case, alpha-lipic acid and vitamin C are also critical because they both have ability to regenerate glutathione. Since it's difficult to increase the level of glutathione within the cell, the nutrients should be able to present in the supplementation so that glutathione can be used again and again. Researchers have demonstrated that when the photoreceptor and retina pigment cell have optimal level of antioxidant present, they're much better able to protect this cell from oxidative damage. The length of eyes is also better protect against oxidative damage when glutathione levels are higher. Zinc and selenium. Zinc and selenium are more important minerals our antioxidant system needs. Zinc is critical for function of our catalytic antioxidant defense system, and selenium is necessary for glutathione peroxidase system. Both of these antioxidant defense systems are essential in the battle against free radicals produced in the eye. If these two minerals are not available in adequate amounts, the two defense systems simply cannot perform at their optimal level. Several studies now show that when these minerals are supplemented, especially zinc, ARMD can actually be stabilized and improved. Faya's story. One of my longtime patients accompanied her husband for a checkup. During the visit, Fayan told me that she had just been diagnosed with macular degeneration. While traveling to Texas to see family, she noticed that she just could not see anything clearly. She kept whipping off her glasses and putting them back on, only to find that she still could not see well. She decided that time she needed to get her glasses prescription changed. When she got back home, she went to see her local eye doctor, who couldn't find anything wrong. But Faya's sight got worsened. When she went to church, she couldn't make out of the face of the people in the church. Worried, she made an appointment with a local ophthalmologist who specialized in retinal disease. He examined her eye right away, diagnosed macular degeneration. Faya had already lost quite a bit of vision in her left eye, and the physician informed that she had the wet kind of macular degeneration. He would need to follow it closely in case she would need any laser treatment. I explained to Faya the research I had done with macular degeneration and how several of my patients were able to actually get visible improvement by taking nutritional supplements. Obviously, she wanted to try them, so I started her on the supplement program outlined in Chapter 17. Within 2 months, Faya shared with me that she has significantly improved in her vision, and that is even getting closer to being normal. She was now able to see every face in the tour. This story took place 5 years ago, and Faya's continued with the nutritional supplement. Her vision was basically remained stable. Faya's continued to make appointments with her ophthalmologist every few months, but still not needed to any laser surgery. Her doctor told her that her eyes look beautifully. Protecting your eyes against cataracts and age-related macular degeneration. I have shared a lot of technical information with you, but I have done this so that you will have the medical evidence you needed to know to make solid decisions about nutritional supplements and avoid eye disease. This recommendation also applies to those who already have cataracts and macular degeneration and desire to slow down those processes. but I anticipate that you may be wondering, how do I make all this practically? In my clinical practice, I am markedly aggressive with my macular degeneration patient because I want to see if we can actually reverse some of the damage that oxidative stress has caused. I have personally been involved with the more than dozen patients those ophthalmologists have documented visual improvement after following this recommendation. First of all, this is critical for all of us to protect our eye from damaging high-energy sun rays that are the underlying cause of oxidative stress in our eyes. In a healthy young adult, the cornea and lens of the eyes, which protects the retina, absorb most of the UV light, but the cornea lens did not block or absorb the high-energy vision blue light. As we age, the lens of the eyes allow more and more ultraviolet light through and no longer protects the retina from the threat. When it's come to protecting your eyes, the enemy is sunlight. It's very important that we decrease the amount of oxidative stress our body needed to handle. Purchasing high-quality sunglasses that block all UV lights and visible blue lights is a great investment. This means that you do not have to neutralize as many free radicals. Clinical studies concern the eye indicate that when the antioxidant defense system becomes overwhelming, everything breaks down and oxidative stress occurred. We all need to become more conscious about shading our eye and face from direct sunlight. People who work outdoors or those who are involved in sports activity where they are exposed to intense sunlight should especially wear protective eyewear at all times while outside. The other half of the equation is against to build up our body's natural antioxidant defense system. Several studies have shown that by taking nutritional supplements, we're able to do this. In one particular study, 192 patients with macular degeneration took antioxidants and 61 control patients didn't. After 6 months, 87.5% of supplemental patients had visual acuity equal to or even better than the beginning of the study. Only 59% of untreated group had visual acuity equal to better than the beginning of the study. Again, I outlined the antioxidant to take for this in chapter 17. 2 years ago, one of the ophthalmologists in town stopped me in restaurant parking lot. He asked, "What is the nutritional stuff you recommend to your patient with macular degeneration?" I just saw a lady in my office this morning whose vision improved from 20/100 to 20/40 in both eyes. I have never seen this before in patients with macular degeneration. I explained briefly the concept presented in the chapter. We searched for his sunglasses. The ophthalmologist opened his car door. With a wink and smile, he said, "You can help all the macular degeneration patients you want, but don't help those patients with cataracts. We can always operate to help them." I know he was not only joking, and I appreciate this genuine interest in nutritional supplements, since there is little doubt that the underlying cause of cataracts and macular degeneration is oxidative stress. I believe that we must be nothing short of aggressive in our supplementation program. After all, there's no other effective treatment for ARMD, and many patients could avoid needing cataract surgery altogether. And could such a simple solution offer any better result than that? Thank you for listening. Next chapter, I will be reading chapter 10, Autoimmunity Disease. See you next time.